Hello everybody, welcome back to our channel Nursing Career Club. Today we will start broad function of home health aide. Introduction. A home health aide is a trained professional who provide essential assistance to individuals need support with daily activities in the comfort of their own home. It means that home health home health aid is a thing where a individual needs help from the HHA and the other persons. The role of a home health aide is crucial in maintaining the well-being and independence of individuals, especially those who are already disabled or recovering from illness. And the important role of home health aid is to maintain the well-being and health of a individual, especially those people who are suffering from illness and they are disabled to walk from one place to another place. The function to be performed by an HHA in a home setting. Home health aides perform a variety of essential functions in a home setting to support individuals who require assistance due to age, disability, illness, or recovery from surgery. Home health aides perform a variety of essential functions. It means that home health aides perform various functions which support individuals to require assistance due to age, like a, an aged person who is unable to walk from one place to another place, then he requires a need from HHA to help him. The specific tasks may vary based on the individual's needs and the healthcare plan, but there are some common functions performed by HHA in a home setting. And apart from this, there are some important tasks which are assigned to HHA to perform various works for the patients for their health care and some functions performed by HHA in a home setting. The role and responsibilities of a HHA. Personal care assistance. Personal care assistance is such a thing when HHA helps the patient in bathing, in grooming, in toileting, and other aspects. Second one is medication management, and medication we can say it as the proper medicine should be given to the patient time to time and according to the advice of doctors. Mobility support. Mobility support is such a thing when we support the patient in walking from one place to another place with with a walker or any other equipments. The role and responsibilities of a HHA. Meal planning and preparation. Now we will discuss about meal planning. A patient should take meals according to the consultancy of the doctors, and they should eat light food, and preparation of meal should be in light way. Fifth one is housekeeping and light cleaning. Housekeeping is such a thing we should keep clean our house and our surrounding areas, and light cleaning of our house should be done in a proper way. Sixth one is emotional support. We should support the patient emotionally. A, a person should tell the patient that he will recover very soon and the medicines will work on him in a proper way and he will recover very soon. Seventh one, the role and responsibilities of a HHA. Seventh one is safety measures. There are many safety measures like we should use proper mask when we go to hospital and a clinic, and a patient should wash his hands in a proper way, and proper hand washing should be done. At one is collaboration with healthcare team, and we should collaborate with the healthcare team, with the team of doctors and nurses and HHAs, and there should be a proper combination of various advices between the healthcare team, among the healthcare team, and all persons should be helpful to each other in their any circumstances. Next one is techniques of maintain personal hygiene or patient. Maintaining the personal hygiene needs of a patient is essential for their overall health, comfort, and well-being. And if we talk about the well-being of the patient and overall health, and for the good health, a patient should take nutritious food to maintain his health. Here are some techniques and consideration of ensuring proper personal hygiene. Now we will talk about the techniques which are considered to ensure the proper personal hygiene. Techniques of maintain personal hygiene of patient. Oral hygiene. Oral hygiene means that we should brush our teeth in a proper way and we should wash our hands daily, time to time, and we should wear clean clothes and we can feel comfortable. Third one is hair care. Hair care, a person should keep his or her hair smooth and he should use proper oil in the hair and a proper and properly comb the hair so that he can save him from any infectious disease. Fifth one is nail care. A person should get his or her nails get cut, because if the nails are very big then the many diseases can occur in body that may be harmful for the body. So nails should be cut on time. Fourth one is saving. Saving is such a thing that a person can help another person in saving, so that saving should be done in a proper way, and we should not have big beard and our hair should be small. Sixth one is perineal care. Perineal care is a care for our internal parts, our main parts of the body, and we should wear light clothes and time to time keep our body parts clean and infection free. Seventh one is incontinence care. Incontinence care is such a thing that we should empty our bladder time to time, because there shouldn't be a storage of toilet in our bladder. It may be harmful for our body. So we can focus on these things. Techniques of maintain personal hygiene of patient, dressing and clothing care, and we can improve dressing and clothing care by doing a proper dressing to a person or a patient, and we should properly dress up the patient, and we should care of clothes that a patient wears clean clothes at every time. It may be helpful in his good health. Ninth one is assistive devices. Assistive devices are, there are many types of assistive devices like a walker, crutches, and a stretcher and a wheelchair. These are the assistive devices. A patient can use these devices at any time from the fall prevention. Techniques of maintain personal hygiene of patient, education and empowerment, and a proper education is a part of a good well-being and a good psychological condition, and we can save our body from infectious diseases, and a proper communication between the patient and doctor that can help to maintain a well health and empowerment, and there should be a improvement in the health of a patient by giving proper medications at any time. Various method of patient comfort and safety. Ensuring patient comfort and safety is crucial in any healthcare setting to promote positive outcome and maintain patient satisfaction. Here are various methods to achieve this. We should ensure patient comfort and safety, and we should provide safety tools to the patient at any time, and we should care about the patient's health, and we should also think about the well-being of the patient. Here are various methods to achieve this. First one is clear communication, and there should be proper communication between the patient and doctor, and patient should recognize the importance of advice of a doctor, that a doctor gives proper advice along with the medicines, so a patient take medicine time to time without any delay, and the proper communication is a part of our behavior and our culture. Various method of patient comfort and safety. Second one is privacy and dignity. There is a there is an important role of privacy and dignity. A patient should focus on the privacy and dignity. Like a patient changes his clothes in his ward, then there should be a there should be a curtain, and behind it he can change his clothes, and HHA and nurses should think about the dignity of the patient. They shouldn't use bad words against the patients. Third one is pain management. And how can a pain manage? First of all, we we think about the pain. That what are the criteria of pain infection, and what may be the proper medication for the pain management, and a proper medicines should be given to the patient for the proper well-being and a healthy hygiene. Various method of patient comfort and safety, environmental comfort. Environmental comfort is such a thing that our environment, we should keep our environment free from any dirtiness, and there should be a lot of trees and plants in our surroundings so that we can get a fresh air. Fifth one is positioning, and a patient should use positioning in accordance of the doctor, and the patient can establish positioning at any time, and he or she should use proper positioning. Various method of patient comfort and safety, nutrition and hydration. And a patient should need a proper nutrition. Nutrition means like in the food there are many vitamins and proteins and minerals are the mandatory part of a nutritious food. And if we talk about hydration, then hydration is such a thing that when our body loses water, and we feel weak, and we are wet, so we should target on the hydration, and proper quantity of water should be in our body so that dehydration problem cannot be occurred. Seventh one is mobility assistance. Mobility assistance is such a thing that a person helps another person to move from one place to another place with the help of wheelchair and with the help of a walker. Eighth one is assistance with activities of daily living. There are many daily living activities like eating, bathing, dressing, transferring, toileting, working or moving around. Ninth one is emotional support. Emotional, we a person should support the patient emotionally, and in a HHA should help the patient, and he should say to him that you will recover very soon, and the medicines are very useful for you. You should take medicines time to time on the daily basis. It is a emotional support. Infection control. If we talk about infection control, infection is such a thing that occurs when we are not properly bathed, and our hands are not washed, and we don't use masks, then the infection occurs. And it can be occurred by touching one another, and if we come into the if we come with the patients, then the infection can occur. So we have to control on the infection by keeping our clothes clean, and we should wash our hands and we should use a mask. 11th one is medication safety. There are five moments for the medication safety. Starting a medication, that when we should start the medication. Second one is taking the medication, and medication medicine should be taken on the daily basis, time to time, and reviewing medication, and we should review the medication summary and stop medication. And when should the medicines are stopped? We should stop the medicine by the advice of a doctor. Next one is fall prevention, and we can help a person when he is walking through the pedestrians and he is walking on the wet floor. Then we can help him in fall prevention. We can guide him that he should walk slow on the wet floor and on the pedestrians during a walk. If he will walk slowly, then he can save him from falling. So this is a fall prevention. 13. Monitoring and surveillance. Monitoring is such a thing that we should monitor all the activities of a patient and any other persons, that what they are doing at any times and what are the benefits of their activities. And surveillance, if we talk about surveillance, that it is a all the totally activities are keep in contact, and we can observe the things through the surveillance. And we can also say that it is a security system. 14th one is emergency preparedness. Emergency preparedness is such a thing that we should pre-plan about an emergency, because an emergency can occur at any time. So we should be pre-planned for this emergency, so that we can solve the emergency at the occurring time of the emergency. 15th one is cultural sensitivity, and we should be sensitive with our culture, and we should wear our cultural clothes, and we should sing our cultural songs, and we should be very sensitive towards our culture. Professional etiquettes. There are many professional etiquettes. First one is establishing trust and support. We should establish trust in the patients, so that a patient can maintain his well-being and good health, and he can think positive at any time. And what is the support? Support is such a thing that can be done at any time for each and every individuals at any steps. So support is a mandatory thing to maintain a well-being and good health. Second one is ensuring patient dignity and respect. We should ensure the patient dignity, because a patient has his own dignity. So we should care about his dignity, and we should recognize that dignity. And if we talk about the respect, because the patient has his own self-respect, so we should use proper language with the patient, and there should be a proper communication between the patient and doctors and HHAs. And we should honor the patient dignity. Third one is promoting patient safety. And how can the patient safety be improved? Patient safety can be improved through using various methods of healthcare. We should plan for the promotion of patient safety, and we should also think about the safety at any time, so that a, prom- a patient safety can be promoted. Fourth one is enhancing quality of care, and there should be a growth in the quality of care, and we should improve the quality of care by developing various procedures with the doctors and patients and HHAs. Fifth one is improving patient satisfaction, and we should also improve the patient satisfaction, because the may patient always be satisfied with our works, with our treatment, with our communication, with our behavior, so that an improvement can be done in the patient satisfaction. Sixth one is preserving professional reputation, and a professional reputation can be improved by the various resources and at the different places. So we should care about the professionalism, and we should wear professional clothes, and we should use professional language, and we should be professional in our works, so that it is a preserving professional reputation. Reducing legal and ethical risk. We should reduce legal and ethical risk. It means that we should decrease the level of legal and ethical risk, and there should be a proper decreasement in the legal and ethical risk. Eighth one is facilitating effective communication, and the communication of the patient and the doctors can be very impressive, and the process of communication is sender sends a message to the receiver, and receiver again gives feedback to the sender. It is a communication process. So we talked about the broad function of home health aid. I hope that the video was very supportive for you, and if you want to take our notes, then you can visit on our website www.nursingcareerclub.com. Thank you